Good morning. Thank you, Ethan. A little bit of background about why I perhaps can speak to this with some knowledge. I have over 30 years of supervised practice training that I've either trained students in renal nutrition earlier on in my career, or currently I train them in management, more clinical management, quality assurance, etc. And then previously I was an internship program director, and for 8 years I was part of that volunteer team that Ethan spoke about, who went out and did those peer review of those programs to make sure that they met the standards, which was the very interesting and the hardest work I'd ever done over a weekend. So we're going to talk about what supervised practice is. Supervised practice is that hands-on practical experience that is coupled or married to the didactic learning education program. It is application of all that knowledge that you've gotten over the several years, and it's applied in different practice settings. Usually, the student is working with an experienced dietitian, or what we call in our country a preceptor. But not always. It does not always have to be with a dietitian, and we'll get to that, how you might be able to leverage some other experiences that might, in particularly as you're growing practicing dietitians here. So what does that supervised practice really do? It prepares students for a wide variety of opportunities in an employment setting. I'm attached to a Dietetic internship program in my life, and that is it's 10 months after the students have gotten a bachelor's at a university, at any university that's been accredited by the ASCEND program. And during that 10 months, they go to a variety of practice settings to be able to interview, per se, or to see what those settings are like. I loved the science of nutrition. I got to my Dietetic internship program and had no idea what the practice of nutrition was really like until I stepped foot into a hospital of dietitians, because science and practice is often very different. I have a good pediatrician friend who says, I know a lot about pediatric medicine. He spends 90% of his time doing vaccinations and growth and treating a series of childhood diseases that he is probably maybe 5% of his knowledge in that area, right? But occasionally he gets the opportunity to use that other really highly skilled knowledge. So supervised practice in the United States is often in hospitals or other healthcare facilities. Those other healthcare facilities could be long-term care, which is a nursing home. It could be assisted living, which is kind of a step down from a nursing home. It could be in pediatric or adult hospitals. It could be in other facilities, not even healthcare, such as schools, daycare centers, correctional facilities. Yes, we do have dietitians in our prison systems. And those roles could be anything from food purchasing to managing staff or to providing clinical services. So oftentimes a student is assigned to one institution where they may get several opportunities and several different roles. Other areas of supervised practice might be in sports nutrition and in corporations, particularly big corporations such as Nike, Google, those big multinational corporations. They provide nutrition and lifestyle opportunities for their employees, partly because we know that if people are healthier, they're more productive, but partly because in those corporations they're working many, many hours, and if those opportunities are there and facilities are there, those employees can just stay there and then go back to work. We also have opportunities for practice settings in food and nutrition related businesses and industries. A few of them have been mentioned, the Kellogg, General Mills, some of the national enteral products like Nestle, etc. Those are some opportunities for supervised practice. And then working with dietitians that have their own business, private practice business. They might have it in their own office or be associated with a physician's clinic. Community and public health settings, universities and medical centers, and also in research areas could be places where future dietitians could get supervised practice. So the role of the preceptor, or that experienced dietitian who is mentoring the student, is really to facilitate the transition from classroom to professional practice. That is sometimes a difficult transition for individuals. Difficult to get out of the mindset of student, where everything is given to you and then you just have to produce on an exam, to move into the role of a professional, working with peers, colleagues, and taking responsibility for what you are learning also. It is not all just given to you. You have to also take responsibility. So those preceptors have the role of a teacher, a mentor, and eventually, as the student gets towards the end of their training period, as a colleague. And it is difficult also sometimes for some preceptors to move through those stages and to finally allow the student a more collegial relationship with them. Preceptors are essential to quality education. They teach and model knowledge, skills, and professional values. It is difficult to teach professional values in a didactic program. You can talk about them, you can talk about ethics, but to see it in practice, to see somebody who has chosen not to continue therapy and does not want to have tube feeding, and you know they're malnourished and the outcome is going to be negative, but the ethical dilemmas or decisions that happen in everyday practice in hospitals, you have to really see that to know how to appropriately model that and how you're going to deal with that in your own clinical setting. They supervise the practice abilities of the intern or student on a regular basis, providing them with opportunities that meet their growth and needs, and not having them doing the same thing over and over and over just because they have that need. As a preceptor, I have 6 patients I have to see. They all have diabetes. You've already seen 18 diabetics and have plenty of knowledge, but still do those 6 for me because I don't want to do them. That's not the role of a preceptor. It is also to give constant feedback to that student, both positive, which is really important as people are developing their skills, as well as in a way to give them practice suggestions how they can improve. As a student working with several different preceptors, I developed my own style, my own way of interacting with patients, because I'm an individual and I have what I bring to the table in my personality. But I distinctly remember the different ways my preceptors, 35 years ago I think it was, managed certain patients. And I can hear myself approaching that even after all these years of practice, because we do take away those from our preceptors. Preceptors guide young professionals as they prepare for the credentialing exam too, because our credentialing exam is a mixture of knowledge and practice. And particularly when we get into those exams for specialized practice, it is predominantly practice-based. So the role of the preceptor is to assess the intern's prior content knowledge. Somehow, because again, we take students in our program, and all internships do, from universities across the country. Some universities, we all have the same competencies, but by nature may have a higher level of expertise in a certain focus area of dietetics. Oregon State University, which is the university I graduated from, is a much more administrative management focused university. I happen to have graduated in pre-med and then went into dietetics, pre-medicine, and so I had a science base, and so my administrative skills from that institution isn't as strong as others. Other colleges are really focused on medical nutrition therapy or in public health, but we might then bring them all to the supervised practice area, and a preceptor needs to know what experience that person has had so that they can take up seamlessly that future education. And if you don't do that, then it is less successful. Discuss potential ethical concerns. Identify the student's strengths and weaknesses. And we tried to have the student self-identify strengths and weaknesses. What did you get from your last experience? Or what did you have in your undergraduate program? And what do you really think you need? And let me help provide that for you. And along the way, I'll figure out if there's some other things, too, that you might need that you haven't self-identified. I think involving the student in that decision really makes their experience more valuable. Identify the usefulness of self-evaluation. In the supervised practice experiences, whether in the coordinated program or an internship, at the end of a rotation, we call them, so they may spend 5 weeks with a dietitian in medical and surgical units. After that 5 weeks, the student needs to do a self-evaluation, as well as the preceptor. And the student needs to really reflect and provide and make sure that they are thinking about their strengths and weaknesses. You get students all the time that think they're fabulous in every area. And I'm going, oh, well, that's nice. I don't know anybody, including myself, that's fabulous in every area. And students who are not very confident and downplay what they have accomplished. And so during this process, too, their skill development in just self-evaluation, I think, is very important to make a good professional. And they need to demonstrate the theory to practice. It may be fine and dandy to say that a 2-year-old needs to have this many calories, protein, and this variety of food. And if you've ever not worked with pediatrics or been around young children, it's pretty impossible to convince a 2-year-old to do exactly what you want, right? And oftentimes students come and think they can do that, and they get a rude awakening as how to interact with different groups. So skills and attributes of a preceptor were identified by Walker in the Canadian Journal of Dietetic Practice in 2010. And some of those skills and attributes that make the individuals good preceptors: knowledge and experience, current clinical knowledge. The most frustrating experience that a student can have, either in a didactic or in a clinical setting, is that somebody is not up on the current practice of nutrition. Now, into this day and age, we're so into evidence-based practice, all of the resources are so available, it's not as often, but I can remember having a preceptor that I thought, oh my gosh, did you not look at that journal article in the last 10 years? Experience and expertise, and those are different. You can be expert in a subject area coming right out of school, but it doesn't have the experience to go to be able to really bring it home how to become a professional. Good clinical judgment, taking that evidence-based information, looking the entire picture, deciding along with the client or patient what would be the best next steps. And that's a skill that only practice can help you develop. Personal characteristic, positive role modeling. If a student is with you and you emulate that you really don't like your job, they're not going to have a good experience, and they're not going to have a good feeling about the profession. Being honest and kind, and you can be both. You can give feedback, not so positive feedback, in a kind manner. And I think that, at least in the United States, that has changed in all professional training over the last several years. It used to be 35 years ago. Well, I was trained this way, and my preceptor, told me it straight front. I don't care if you cry. I don't care if your feelings are hurt. I'm going to, this is what I was exposed to. Therefore, I'm going to teach you that way. It's kind of like parenting. Well, that's all evolved, and students really do learn better when feedback is honest, but is also kind, and in a way pointing out changes in their behavior, what they're doing, and not making it pointed at their personality and style. Professionalism is a personal characteristics emulated that students think important in preceptors. being approachable and available to students, being there for them, and a sense of humor, because it makes the medicine more easy to take if you do it in a humorous way sometimes. In teaching skills and attitude, objective evaluations. So having objective criteria set up ahead of time, telling the students what you expect from them, and having ways to get to that. As I say, I can remember when I was training, you sort of had to guess what the preceptor wanted out of you. That's not fair in a job or in education. People can meet expectations if they're spelled out. Fair and honest feedback, good communication and listening skills, and again, enthusiasm for what they're doing. Interpersonal relationship, a respect for the student's experiences and opinions. And then friendliness. So it is really a mentor and mentee relationship when you get into supervised practice and with these components. The mentor has an intrinsic benefit. There are intrinsic benefits of teaching. I love to provide supervised practice because I want to have a place in the education of our new professionals. I also, because it makes me keep up with my literature reading, with what's current, because we all have stacks of paper, maybe it's files in our computer now, of information we should be reading, but nothing more than a student coming to your door, you need to be up to date. The mentor also gets a way to develop your, as a professional colleague, develop a lot of self-awareness when you're a preceptor and providing education to those students. Have an opportunity to develop interpersonal relationships, again, professional development, and then stimulation to question practice. Why are we doing it that way? Sometimes you just don't even think about it because you've been doing practice the way you've always done practice. The mentee gets familiar with an organization. Oftentimes students in the United States that go through supervised practice in a particular organization will find employment in that organization. And they have that, as an employer of dietitians, if someone knows the organization, my time of training them has shrunk a bit. They receive one-on-one nurturing in the profession, insight about unwritten rules and policies. There's a culture around all organizations. Assistance with career development. I often have students I don't even interact with that come and talk to me about, this is what I want to do after I get done with my supervised practice. What do you think I should do next? Development of problem-solving skills, that mentee. Increased network of contacts, because then they will be able to reach out for either job opportunities or need more information about other questions. And then increase their communication skills, and supervised practice in this relationship really increases self-confidence. In order to be a good practitioner, you have to be competent in your knowledge. You also have to be confident that you can, in that knowledge too, in order to be a successful practitioner. So for the Commission on Dietetic Registration, which is our body that credentials all practitioners, has a precepting training site that is on the web, and it provides 7 modules. You don't have to be a member of the Academy of Nutrition and Dietetics to go here either. So you could go to this website, create a login, because I'm a member, I have a login that's tied to my membership. But we can use this for our non-dietitian preceptors. So my boss is the Director of Food and Nutrition. He's a food service guy with a master's in business administration, but not a dietitian. He has gone through these modules because what they are really doing is providing information and training to people who work with students. So these modules, preparing your role as a preceptor, planning for student learning, because it does take planning at this level too. We don't do curricula, because often those competencies are done by the director, but you still have to plan. You just can't wing it. You just can't go in there and say, oh, what are we going to do today? It makes the experience not the best for the student, and crazy if you're the preceptor. How to facilitate student learning and how to assess student learning. We have a variety of learning styles. Each one of us have a favorite learning style. I am very visual and kinesthetic. Audio doesn't do it for me. If I'm not writing or seeing it, I'm lost in my learning style. How to communicate effectively, giving good feedback, and taking feedback from the student too. As a young preceptor, I had a student that was honest and gentle in her feedback of me, saying I could be a bit more organized. And because I wasn't, I just, you know, if you're a practicing dietitian, I had a transplant floor, a med-surg floor, and a dialysis unit. And so I had, I don't know, 60, 80 beds of patients to see. And some days you didn't really know what that was going to look like. But not having a plan for them made it very uncomfortable for that student. I now have a plan that changes every day, but at least there's a plan that I've shared with them, and I get good grades now on that. How to manage your time. Students increase that challenge of managing your patient or your duties as an administrative dietitian or in public health dietitian. You have all that to do, plus provide that experience for a student. And then how to keep current. So this might be a resource for you as you're thinking about how to train people to train dietitians. So the Dietetic internship program, as well as the coordinated program, requires 1,200 hours of supervised practice in the United States. It's usually completed in an 8 to 24 month time period, depending on if they allow a part-time schedule or graduate. 8 months is about the lowest if you don't have any graduate credit. 24 months is a coordinated master's program where you would do the supervised practice plus get a master's degree. Appointments to Dietetic internships are awarded on a competitive basis, and most of us use a national computer matching system. So you graduate with your bachelor's degree, you meet all the competencies there that Ethan spoke about, and then you fill out this national application, and you rank order what programs you want to do for your supervised practice experience for an internship. Then those applications go to those programs. I sit on that selection, and programs look at those applications and choose those students they want to come. We graduate more students from our Bachelor of Science degree programs than we have opportunities for supervised practice. It's a reality in the United States, and certainly a reality when you're starting out as a brand new profession. So we struggle with how do we find practice experience, because again, in order to sit for that national exam, you have to have both a didactic and practice in our world. So we have a lot of students that want to be dietitians and cannot find that practice experience. It's been a challenge of ours ever since we began, and it will be a challenge for you too. So this is what we have decided to do in the last year or two, is that we had those very defined coordinated program where the didactic and the supervised were together, the internship which was after the didactic, and now we have developed a plan called an individualized supervised practice, which are alternative pathways to give students more options for that educational experience, that supervised practice experience. These programs are called IPSIs for individual supervised practice because the Academy of Nutrition and Dietetics, just like every profession, likes acronyms. IPSIs are intended to add practice capacity because we have maximized our practice capacity. They are not intended to provide practice experience for everybody who might have gotten a degree in nutrition, because sometimes you can get a degree out of a United States program if the highest grades would be on a numerical score of a 4.0 would be the very highest. You get all A's. Some people can graduate with a 2.0, which are all C's, with many or some D's, etc. And they may not be the best people to move on to the profession. But we have so many that have outstanding academic records but don't have a place for practice. And so that also provides multiple pathways to registration, and it facilitates collaboration among programs. And we have done a lot of work at the academy level trying to get more practicing dietitians to become preceptors to provide supervised practice. We truly believe it's a role of a very important role of the profession, and as a professional, to provide that experience to the newest people that entering our profession. These ISPEs also do assessment of prior work experience at a national level. So at the ASCEND level that Ethan was talking about, they can help with that assessment of prior learning experience to figure out what this student needs. Because we get a lot of individuals that are coming back for second careers. So individuals such as chefs that have been trained in a high level as a chef may want to then add some Dietetic internship to their credentials so they can work as a dietitian. They'd managed a kitchen, they know all those cooking techniques and the composition of foods, and they'd managed 30 people on staff. They likely don't need to know how to manage individuals. Oh, I thought I had put in that extra slide. I guess it didn't stick. Wonder where it went. Do you think it's on the C drive? We won't go there because I'm already over. The slide I tried to add this morning are, as you get started, some thoughts I might have for you as to how to perhaps get to the point that you'll have practitioners who could step into the role of supervised practice. And Anne today is going to speak more practically about specific examples. I'm going to be more theoretical. Let me see what my notes are. You could have students work with other healthcare professionals or other professionals in a hospital setting, and that happens all the time even now. We have a physician that is very much an expert. He has a PhD in nutrition as well. He's a surgeon. He does nutrition support rounds. If we were 40 years ago and it was just him, he may be the one that's doing that kind of practice because he could show what the patient is like. We look at what kinds of diets or feedings they might need, and then the dietitian could learn from him. Could learn from that culinary professional out in the kitchen. It doesn't need to be a dietitian that's out there. A dietitian needs to work with that preceptor and to make sure they understand about the competencies they need, because it is not meant to be the baker who called in ill today that intern should bake 8 hours worth of cookies, as an example. That's not teaching them something. You need to know how those food production works, but you don't need to do it over and over again. It could be role-playing, having practicing dietitians doing a little talk, doing an example of how you might interact with a patient with diabetes, for example, and then having the students practice that. It is exactly like simulations without all the technology, but using technology, as Ethan said, is a prime example. It could be skills development workshops, putting that theory into practice. I believe Gigi, over the next couple of days, is going to do some skill development workshop, right? And that is so important because we can only do what we have been shown and have done a couple of times, and then we have the confidence and the ability to do it with a patient. And it could be practicing those skills within a didactic program. And I don't know if this is at all possible, whether it's to bring in dietitians into your hospitals, your other facilities over a short period of time and doing specific kind of rounding over a couple of weeks with students there so they can do that, or whether there's any opportunities between countries to have students in an economical way, if they spoke the language, to see dietitians in practice areas. It might not be specific to how you have set it up in Romania, but dietetics around the world with some modifications is dietetics. And so I think there are opportunities without so many dietitians to provide experience to do that. But I do want to say, any dietitian that's working now, please give back to your profession and agree to provide student opportunities when asked, volunteer for it, because it is really what makes the profession grow, and it is integral to the knowledge that they've gotten in their university setting. So with that, thank you.